Hi, my name is Dr. Sandeep Chauhan, Orthopaedic Surgeon at Maitri Medicare, Gurgaon. Today we are going to talk about hip fractures in the elderly population. We understand that the hip fractures could be painful and frightening, and these sudden fall or accident causing these hip fractures could be a life-changing event in the elderly population. We are here to provide specialized care for your need throughout your treatment and recovery. The hip fracture is a break in the continuity of the femur bone, the largest bone in the body. The fracture takes place in the head, neck, or the upper part called the trochanteric part of the femur. The fractures could be displaced or undisplaced. The risk factors for these hip fractures are basically increasing age, which leads to decrease in the bone strength, which is called as osteoporosis. Multiple medications which these elderly population people are usually taking, their poor coordination and balance, and on top of that, poor vision leads to frequent falls, leading to hip fractures. These fractures are more common in elderly female population and account for about 80% of injuries in this age group. Complications that can arise from a broken hip injury are: it could lead to blood clots, it could lead to pneumonia, urinary tract infections, and bed sores in this elderly population if these people are lying in the bed and are unable to move around. The risk factors for hip fractures in this elderly population being malnutrition, falls, inactive lifestyles, and previous hip injuries. Usually, these hip fractures are investigated by X-rays, and after optimizing the patients in terms of blood pressure, oxygenation, and other parameters, the main line of treatment for these fractures is surgery. The type of surgery depends upon the type of fracture and the health conditions of the individual. The main aim of the surgery is to align the bones correctly and so that they can heal in the anatomical position. The various type of surgeries for these hip fractures include fixation with screws and plates, with intramedullary nail called as the proximal femoral nail, or in some cases even partial or total hip replacements can be done. Usually patients with hip fractures present with history of fall and complain of pain and inability to bear weight on the injured limb. In rare instances, if the patients are terminally ill or the fractures are undisplaced, then sometimes conservative treatment can be offered in terms of pain management and physical therapy. The goal of the treatment of hip fractures is to enable the patient to do most of the things you could do before the fall or injury with as little pain as possible. Post-operatively, the patients are kept in hospital for 2 to 4 days, where the customized rehab plan and pain management is done so that each individual is customized to his physiotherapy protocol according to his muscle strength and comorbidity conditions. Patients are motivated to be mobile as soon as possible as their condition allows so that they have least complications. We can prevent these injuries by following certain precautions, that is, improving our bone density and staying more active. Secondly, we can ensure that the rooms where these elderly people stay should be well lit. and all kind of obstacles which can lead to falls like carpets, rugs to be removed. The bathroom should be more safe with anti-slip mats and handrails. And lastly, their chairs should be more stable for sitting, and their footwear should be anti-slip with flat soles. I hope that this video is informative to take care of the health of our elderly population. Thanks for watching this video.